And we are back with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. She's answering your COVID-related questions. This question says, where can you go to a breathing clinic?
And so I believe that's in response to like a clinic just dedicated for respiratory illnesses. And there are some affiliated with Cone Health, but I bet you I've heard of other respiratory clinics with other health systems as well. And you might also just call your primary care doctor. I think a lot of them have realized the importance of seeing patients who've recently have had COVID and may need to be seen.
Okay. This person is asking, after testing positive, do I need to see my physician for care, or can I just have a positive test and just deal with it at home?
So yeah, not everybody, actually, I think for the most part, not many people need to go see their primary care doctor specifically for having a positive test. It's, the folks that are most at risk for being hospitalized with this are those who are immunocompromised or who have a lot of health problems, those who are older, and especially if you are unvaccinated. So all that really are those some of the risk factors where you would seek care. If you are feeling fine and it kind of just feels like, a bad cold or a flu where you can just stay hydrated, stay at home, and lay down and relax and stay hydrated. Those are key things about getting over this.
Okay. All right. So the next question is, what's the latest on either COVID viruses being on food, packaging, mail, carry-out food, that kind of thing?
We've learned a lot of lessons over those last couple of years. And as opposed to the original strain of SARS-CoV-2, we don't believe that this is really transmitted through like packaging or fomites and such. So just continue with the 3 W's. Hand hygiene in general is great, but you don't necessarily have to spray bleach or wash down any packaging that you receive.
Okay. That is something that has changed and that we have learned over the course of time, right? All of the science and the data is not going to stay the same. We're going to continue to learn things as we go through this. All right, so this next question is, I stopped having symptoms this past Saturday. How soon can I go out? And then they did say with a mask. So they know that they have to go out with a mask, but they're wondering how fast can they get out of the house if their symptoms stopped on Saturday?
Right. So, one of the most recent CDC recommendations was the isolation period for folks who get COVID. So if you test positive and because of symptoms, you should stay home for at least 5 days. So we say that you test positive, that next day is considered day 1. So you stay home for 5 days, and at the end of those, so the 6th day actually, if you are asymptomatic or very mildly symptomatic, you should wear your masks for the remaining 5 days, and then and continue to do things. But the safest thing is probably to stay home for 10 days.
Mm-hmm. All right, so this person says, if a patient had only the first vaccine, then they got COVID, how long are the antibodies and just the one vaccine going to protect that patient from getting COVID-19? I guess they're wondering, when do they need to get their second shot or their booster?
Yeah, so similar to be it if you had COVID-19 back in November or even in the beginning of December, you definitely did mount some antibodies through natural immunity, but we still recommend a booster vaccine probably as soon as you recover, or definitely like 3 months after the natural infection.
Mm-hmm. Okay. This question is, I should know this. My daughter and granddaughter both had COVID, but at what point is it safe for me to be around them?
So it is safe to be around them when they have finished their isolation period. So if they have been beyond 10 days, you can be around them.
Okay, so if they've finished their period of staying at home, that kind of thing, without those kinds of symptoms. Okay, this person says, will the booster injection render a positive for COVID on a PCR test?
So, yeah, I think that's a great question. So the vaccines should not interfere with any of your testing. be it antigen testing, the home kits, or PCR test. So the only thing though is that we just want to make sure that when you go to get your vaccine that you haven't recently been exposed or have a test pending during that time.
Okay, gotcha. All right, we're going to continue to take your text questions. The number right there at the bottom of your screen, 336-379-5775, and we'll be right back.